Wannabe totalitarians on the Hill call to silence anyone questioning their narrative.
There are actors seizing on widespread concern regarding the coronavirus to intentionally spread disinformation at a time when people are worried and vulnerable and willing to believe what they're reading often. One conspiracy theory is seeking to attack people in this country, blame them, in this case, Bill and Melinda Gates.
In the same breath, Cory Booker wrangles in Russian disinformation with anyone questioning a coronavirus narrative that the Bill and Melinda Gates Foundation propagandized on Netflix and at a pandemic exercise event known as Event 201 that occurred just 2 months before the beginning of the outbreak of the Wuhan coronavirus.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic.
Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad?
Meanwhile, the official numbers blow past the reports of 100,000 infected, 3,600 deceased, and 60,000 recovered from a novel virus that has everyone guessing about its origins and its final outcome.
It can happen quickly. A Marshall-type plan, don't mean to say that exactly, but a Marshall plan that can go into effect can stimulate change very quickly.
So we'll fund a few projects to build specific vaccines, but not only will we get that, we'll prove out that these platforms can work, we'll understand the regulatory issues, and it gives us a chance of being able to respond in time when the next epidemic hits.
The spread of the coronavirus has the potential to destabilize governments from the top down, as has been demonstrated in Iran, as the head of an Iranian government task force on the coronavirus, who had urged the public not to overreact about its spread, has tested positive for the illness himself. There have been 6 politicians or government officials killed by the virus in Iran so far. Mongolia's President Khaltma and other government officials had submitted to a 14-day quarantine after returning home from their visit to China. And as confirmed cases in China exceed the reported 80,000 mark, and Chinese workers are returning back to work, which Chinese officials say will spread the disease, meanwhile, airlines and tech companies face a potential financial bailout. The cancellation of major events, including the 2020 Tokyo Summer Olympics, add to public anxiety. Unforeseen headaches pop up, like cyber attacks on healthcare systems, as those that occurred recently at the University of Kentucky. All this as cases continue to double every 6 days. The United States healthcare system faces an implosion, as Zero Hedge reports. A sobering analysis of how coronavirus is likely to impact the U.S. healthcare system suggests that hospitals will be quickly overwhelmed with patients and that all available beds will be filled around May 8th if the virus tracks with Italy's figures and 10% of patients require an ICU. John Bound reports.
Today than you were last week.
Well, it depends on what you mean by optimistic. We are certainly, now that we have tests out and get a better handle, but clearly I'm concerned about community spread. You have to realistically be concerned about community spread.
One fact is abundantly clear. We cannot know the status of the outbreak if we do not know the status of the outbreak. Meaning, knowing the full extent of those with the coronavirus in your local area remains a mystery as long as test kits are in short supply. But are they?
Because of the president's leadership and because of extraordinary efforts by CDC and Health and Human Services and our partners in state labs around the country, we have the testing necessary to be able to provide tests to all the states that have requested it.
In Seattle, Washington, where 83 cases have been confirmed and 17 have died as of the writing of this report, public health officials have recommended that people work from home and that people with pre-existing conditions and anyone over the age of 60 avoid large crowds at concerts, sporting events, and social gatherings. In an outbreak of this growing magnitude, the University of Washington is testing employees for coronavirus without having them leave their cars. With an average test result in roughly 24 hours, will this model grow exponentially? As the Seattle Times reported, modeling by Trevor Bedford, a computational biologist at Fred Hutchinson Cancer Research Center, estimated that the actual number of cases in the Seattle area was about 600. Unchecked, that could theoretically increase to 30,000 by the end of March, Dow said. Meanwhile, Washington State resident Bill Gates will offer home testing kits in the next few weeks, which begs the question, why is Bill Gates more prepared than the CDC? And will Bill Gates emerge as a champion of the globalist left, putting to shame a federal response that until now was prepared for outbreaks, as U.S. News and World Reports wrote, starting with the 2003 SARS epidemic and the avian influenza outbreak of 2005, many U.S. hospitals, nursing homes, and other health facilities started putting disease outbreak preparations into place, according to a trio of experts at Johns Hopkins University. Then in 2009 came the notorious H1N1 novel strain of influenza. H1N1 was linked to reports of severe disease, and no specific vaccine was available. However, because U.S. federal, state, and local governments had already been preparing a coordinated response to disease outbreaks after SARS and avian flu, by 2009, many health care centers were quickly able to activate their pandemic flu plans.
The federal government and the Trump administration have completely failed up until now, and we are now weeks and weeks behind where we should be.
Given the history of the media's unrelenting attacks on the Trump administration, how can anyone truly know how the response is going? Even after Vice President Mike Pence promised 1.5 million tests, and President Trump has pushed an all-hands-on-deck approach, especially during an election year when the left's leading candidates are a Democratic socialist and a deteriorating senile career politician.
This is Mike Adams from Pandemic.News with an important set of predictions and updates on the coronavirus outbreak. First of all, just as predicted, now that the labs have begun to test in America, we're starting to see many new cases confirmed in New York, in Chicago. There are 15 U.S. states now that have coronavirus infections confirmed. Of course, it's killed at least 6 people in Washington. You may recall 4 weeks ago, I told you that Seattle had an outbreak that was already known by government agencies, i.e. Homeland Security and the CDC. They covered it up. They tried to just shut down testing. The CDC succeeded in shutting down testing for about 4 weeks. And during that time, the virus exploded all across America. So right now, today, there are approaching 10,000 infections in America. The virus is right now spreading on domestic commercial flights. All of us who are telling the truth about this, who have been 100% accurate from day one, we are being censored, smeared, deplatformed, all the usual things, but now doubled because there is an effort to hide the truth, to bury the numbers, and just yesterday the CDC pulled from its website the statistic that showed the number of Americans who have been tested by the CDC. We've now entered the rule by secrecy phase of the cover-up, where the CDC is actively deleting data to deceive the American people and withhold from America the truth about who's tested and perhaps even about the number of infections that are confirmed or even the number of deaths that occur. Now, fortunately, at the moment, we're getting accurate information from the state governments. So we see the governor of New York State come out and issue a press conference and a statement. We've got the governor of Washington State that has issued statements, and the governor of California has taken action. There are governors of cities and counties that have declared emergencies. I saw a press release from Santa Clara County, a public health official, that was really the most enlightened and accurate press release I've seen yet from any official. So it seems like the more local you get, the smaller the government is, the more honest it becomes. But the more national you get, the more dishonest it is, to the point where you have the Surgeon General now saying, don't buy masks, people. And then he says, masks don't work, and we need them at the hospitals. So if they don't work, why do you need them at the hospitals, Mr. Surgeon General? You see, we've entered also what I call the idiocracy phase, where the level of incompetence at the federal level, at the top of the government, is so high now that it's questionable whether we as a society even have the functional intelligence to deal with this. I think we don't. As I said last week, we will have tens of infections confirmed this week in the labs. Next week, it may be hundreds of infections. And within 2 or 3 weeks after that, it may be thousands of infections if the labs are reporting the truth. Now, at some point, there's going to be federal pressure for state labs to stop reporting infections. So it's apparent that America has now gone the route of China. Instead of transparency like South Korea, it's all about covering up the number of infections in order to try to control public emotions and control the narrative, even if you can't control the virus. In fact, right now, it looks like the federal government is more interested in controlling emotions, but not the virus, because the virus is still spreading nationwide. You've got doctors in TV interviews now screaming about how they can't get anybody tested. The testing is still not being done on a large enough basis to stop this. And so this is spreading right now by design across America. And it's going to continue to spread until they shut down society. I'm talking about quarantines of major cities. I'm talking about a declaration of medical martial law in one way or another. Well, it'll be called a national emergency. There will probably be bans on domestic air travel to and from certain cities where the outbreak is occurring. Ultimately, we're going to see tens of thousands of infections across America, almost certainly growing to hundreds of thousands of infections next winter. Some epidemiologists say there may be a lull in the infections over the summer because of the hot weather. There is no evidence of that whatsoever. They're referring to influenza. The flu doesn't spread during hot weather as much as during cold weather. This is not influenza, this is a coronavirus. And there's no evidence whatsoever that the summer will magically make this thing disappear, especially when it's spreading inside buildings, airplanes, schools, nursing homes, right, cruise ships. It doesn't matter what the temperature is outside. So this argument that it's going to go away in the summer is rooted in no evidence whatsoever. And then on top of all that, I see Trump officials at the CDC and the Surgeon General and Homeland Security out there telling people do not prepare, it's bad, while at the same time the U.S. military is buying up every bioprotective suit, every mask they can get their hands on. And Mike Pence announced that they've done a deal with 3M to produce millions of masks a month. If you're going to produce millions of masks, why are you telling people not to get them? So this is a very bizarre, deceptive case where you've got the government preparing like mad, the government buying up food supplies, the government getting the personal protective gear. And you recall a few months ago, the government was buying up every night vision device they could get their hands on. That was right before this thing hit. And at the same time, this government is telling you, the citizens, do not prepare. You don't need any of that stuff. These are not accidents, folks. These releases are deliberate. This will infect every city in America. There will be quarantines, there will be medical martial law. In some cases, starvation, desperation. People dying in their homes, the hospital beds will be overrun. And you are told, do not prepare. Well, if you're dumb enough to believe the media, the official sources, then you might just die from this. But if you're smart, then you will get prepared because you know what's coming. And when you are forced into quarantine in your home or apartment for 30 days or longer, you won't die because you've got food and supplies, and you've got maybe povidone iodine, isopropyl alcohol, chlorine dioxide, all these different molecules and chemicals that can be used to sanitize surfaces.
Positive. Positive. Damn it. This whole damn town's infected.